went from the bonnet, found face down on the floor.
2, 3.
Pediatric trauma
It's a stabbing quadrant.
25 feet from a ladder onto his back.
He's really unwell, and I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
King's A&E, how can I help?
King's College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toe, head, chest, abdomen.
A place where love, life, and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
He is having IV fluids for sobering up. This man's absolutely hammered. Naomi stuck a line in him and he pulled it out. And he then threw himself on the floor in the cubicle.
I like that name, Lopez. It's a great name. Or Jesus, I love the name Jesus. Yeah, Jesus, that's a great name, because it's spelled Jesus, but it's pronounced Jesus.
A is still having his fluids and waiting on sobering up. He'll be here till this time tomorrow. The new man gone into 15 who's drunk, who's fallen over and hit his head. It's Saturday night, darling, and I'm afraid the drunk head injuries come in on a Saturday night. Look, these people are hardly sober, are they?
2 minutes. Head injury, 27-year-old head injury. We know nothing more.
Dr. Flur is the lead consultant on duty, responsible for every trauma case that comes through the doors.
Quite combative and aggressive with alcohol, so that's all security.
Okay, great, okay.
It's her first week in the role.
Do you want to
just try and keep quiet?
Go across the side. Lovely, okay.
OK, sir.
Thank you.
Well done.
So we don't seem to have an immediate airway problem. However, we might have a assessment, sedation, need to scan problem.
He's got an obvious head injury.
Yeah. Yeah. Matt, do you want to just take the role of just trying to calm him down?
If you'd asked me a couple of years ago if I wanted a consultant job at King's, I probably would have been too daunted to think that that was an option.
Have you been drinking?
Yeah.
What have you been drinking?
Jack Daniels.
How much?
A lot.
What, since this morning or all night?
All night long.
Oh, OK.
All night.
Welcome to the world of trauma.
Yep. Yeah.
That's all you have.
I've never been really searching for that trauma, adrenaline kind of medicine, but I've been totally surprised how much I've really loved it since I've been here.
OK.
All right, sweetheart.
OK. We've got a trachea deviated to the left-hand side, a right-sided chest wound.
I don't think I'd use the word exciting. Exciting kind of implies it is something that you're looking forward to. I wouldn't describe it like that.
His friend looked a bit...
Bit what?
youth.
Youth?
Youth.
I don't even know. You're talking a different language to what I understand. What do you mean?
Hoodie, you know, or...
But that is... they are our people.
They are our people.
They are our people, aren't they? Hoodie, a little bit edgy, dodgy.
Street.
Street, yeah, street. Yeah, absolutely. It's not for me, I'm not here.
Hello, Kings A&E.
We also have a lot of other patients there who are elderly, who have children. So it's a very challenging environment.
Hello, Kings. Pediatric trauma call, A&E resus, 5 minutes.
Paramedics have been called to a flat where a 12-year-old girl has fallen down a flight of stairs.
8-year-old that's fallen down some stairs, C-spine immobilised. Can you not both go? Because I can't do all the lifting on my own, because I'm not very strong. I'm 6 months pregnant.
You're kidding me.
Thank you.
You're kidding me.
Why didn't you tell me? It'll be fine. It'll be fine.
When they walk through the emergency department door, they're often at their most vulnerable and most scared. As a parent, you can't help but feel a slightly different level of empathy for that family.
Yeah, get her across and then we'll take the hands over.
Right, this is 12-year-old Grace. Grace fell down 8 to 9 wooden stairs. She's gone down on her back. Mum heard her hit the deck. She was grey and sweaty and hyperventilating. So when we got there, she was crouched over, complaining of back pain all the way down and C-spine tenderness all the way down.
OK.
OK, Grace, we're just going to check you out first, OK?
We've got a pulse of 94. We're just waiting for a blood pressure.
That sort of fear that you see in parents' eyes when they're bringing in a child that's very unwell, you can really be there with them.
Do you want to just go up and stand with her? Yeah, no We're just examining, but she'll be happier if you're there.
The way she fell and, you know, and how she did look, her face was grey and I've never seen her look like that.
We felt the pelvis. Just feel gently around the pelvis.
You're doing well, Grace.
Yeah. Where I'm pressing hurts? Okay. That hurts? Okay.
It's that bond you have with a child, with your own child. You know, it's you don't have to think about it. It's just an instant reaction to their needs. You just know instantly that that's your child and you would do anything in your power to protect her.
But we need to do a log roll and examine the C-spine and the rest of the spine as well. C-spine.
You can only imagine how terrifying that must be to be strapped down in a place you might not even know where you are.
Some tenderness over the left iliac crest.
And all that they can hear is the voices of many, many people.
Grace, my name's Flur. I'm one of the consultants. Now, when you're lying there now, can you tell me where it hurts the most?
Yeah, more around the neckish, backish.
Neckish, backish. Yeah. OK, well, then we need to examine your neck and your back, OK?
You always have to think, what is the worst case scenario? What is the worst injury this patient could have?
1, 2, 3.
Right, well done. You're being very brave. OK, that's it. Now just try and relax a little bit.
Maybe they've got a cervical spine or a spinal injury.
It's OK. There, all right. Down here.
Yeah, there.
It's all there?
Yeah. There.
There, over these muscles here?
Yeah. No.
There?
Yeah.
OK, well done.
The way that a child's spine responds is slightly different to an adult's, which makes actually diagnosing a spinal injury in a child even more difficult.
We're going to pop the collar back on, OK, and we're going to get some X-ray pictures of your neck and of your lower back. OK, so it's sort of, it's lumbar, really. OK, fine.
Okay, 1,
12-year-old Grace has been brought in with potential injuries to her neck and spine, having fallen down a flight of stairs at home.
Get pelvic x-ray, lumbar spine x-ray and C-spine x-ray. Yeah, OK. We've just had a pediatric trauma call, a 12-year-old that has fallen down 8 wooden stairs. So I'm going to request C-spine, lumbar spine and pelvic plane films.
Following the x-rays, doctors will also scan Grace to reveal how badly she's been injured by the fall.
She has fallen down 6 to 8 wooden stairs, bless her, on her back. Mum found her grey, clammy, hyperventilating, complaining of pain. She was really, really in a lot of pain. Ambulance come, immobilised her.
She wants to be a singer. She sings from the minute she gets up to the minute she goes to bed. She teaches herself piano. She just wants to be famous. She's kind. She's demanding. She's caring. She's everything, really. Everything. I would jump in front of a train for Grace if it meant that it would stop her getting hurt. Stop her getting hurt, I would take any pain whatsoever.
Swing your legs round for me, Sam. Stay nice and still, darling. Stay nice and still, OK? It'll be fine. All right, it's just going to sting for a minute.
Crazy night in A&E starts with seeing ambulances parked all down the ambulance bay, walking into the waiting area and seeing it absolutely rammed. You just know that that's the start and it's not going to stop.
Hey, police, why you here? Why you here? I'm gonna... This is my business.
You know, you have people coming over that are very unwell, you have people that are drunk, on drugs, and then people that are upset or extremely worried about their loved one. Yeah, all that can lead to some strange and sometimes quite aggressive situations.
I mean, what are the police doing tonight? Are they bringing everything in off the street? Seriously, look. Hello.
You all right?
What's wrong with this charming man?
Police have escorted a man into King's A&E.
Get him in next door, I'll sort him out quickly. Right, let's get him into number 4, please. Let's sort him out and get him out there. He's been tasered. He needs quick, brief medical clearance, and then can we get him out of here? That'll be our stabbing, I think.
3 sus.
It's busy, it's noisy, there's always police.
I'm worried about your head injuries. Because you've got lots of bumps on your head. You've got...
cool, baby girl, it's cool.
No, I don't think
Shit
it is. You all right?
Well, no, because this is going to cause me a lot of aggro. Well, they've tasered him, and they're like, well, he's very subdued now. Now, the police had to be called because he was so violent and aggressive on scene. They've tasered him, and of course he's subdued now, but that means they want to leave. So I'm going to end up having an argument, me feels. If he's been really aggressive with you, I can't allow you to leave. That'd be lovely, thanks.
Patients are often under the influence of alcohol, so they can be quite aggressive.
I know that fucking house. I love this shit. I love this shit.
When we get people in that are aggressive, I always make sure that I tell them that they need to have a bit of respect, not only for myself and my colleagues, but also for the other patients and relatives that are in the department at the time.
Dexter.
Sarah and Andy have brought in their 10-month-old son, Dexter. He's been vomiting and has a fever.
This is Andy.
Hi.
This is Dad.
I'm Rebecca. What's brought you here today? What's been happening?
This morning he woke up with a temperature of 100. I gave him some Calpol, and he had his breakfast fine, but then he had a 3-hour sleep, which is unusual.
Okay.
And then when he woke up, he then started to cry. His teeth were chattering. He looked hot. I took him out of the high chair, and then he just went like this, and he was completely on the spot. I couldn't rouse him.
Sorry, I'm trying to be as speedy as I can because we're absolutely rammed now.
I've been here a few times in my youth. This is when it all gets crazy.
His heart rate is a little bit high for his age. So, has he got little spots there?
See here as well. Just here.
We'll see if we've got space. Can we pop Dexter, 9 months old, to try and catch a urine? We check his blood sugar and give him electrolyte.
A&E is probably a very daunting environment for parents to bring their children to, particularly on a Saturday night where it's very busy. There's a lot going on that you may not want your child to be exposed to, and therefore, if you're bringing your child into that environment, you must be really worried.
Can I have a porter to resuscitate the patient to theatre? Thank you.
Amphitheatre.
No, to resuscitate a patient in theatre.
So it died.
Somebody who stopped breathing. You need to get someone in, get them breathing again. Yep.
Can I cancel the porter to resuscitate you?
It's either few or he's dead. It's one or the other, isn't it?
Dexter's fever could be a symptom of a serious infection. He's given fluids while doctors carry out a series of tests.
It's so difficult because you kind of like, I'm watching him, his teeth chattering, and I'm thinking, so when the paramedics arrived, I had him wrapped up in his green blanket, so his green blanket was covered in bomb. So the paramedics goes, right, Mum, come on, strip him off, all the way down to his nappy. Come on, Mum. And I was like, but his teeth were chattering. And he's like, that's just a reflex in babies.
That's why I blanked my mind out to it. There's no point worrying about that worst case scenario. You know, just be optimistic, just think it's going to be okay, and if it's not okay, then you deal with it.
You've been a perfect mummy today. You've done everything right. Everything.
I always draw on the situation when my mum was unwell and you know, she was in intensive care and my dad was doing a speech at a family gathering, you know, and he's just so calm and collected, and his whole outlook on life, you know, is you have to be positive about every situation. You can't live your life in fear of those situations.
Grace has sustained potentially serious injuries to her neck and spine after falling down the stairs at home. Doctors are taking her for a CT scan to assess the extent of the damage.
1, 2, 3, move.
Where's your mum go? She might send mum out.
Just through that door.
room. Yeah, go through that door. Just while we do the... Yeah. OK.
I think my mum, she was a lot calmer than I was. She was fun. She was fun. You know, there wouldn't be anything she wouldn't do. She was just a character. Her funeral, the whole of Bermondsey came out for her, which was amazing to see, all the young kids. You know, it was just amazing to see that they all came out, you know, to pay their respects. Well, for a little old Irish woman. it's not fair on her, you know, because I haven't got my mum now. She lost 2 nannies in the same week, so, you know, she's had it hard. Because I am a single parent and she hasn't got her nans, and, you know, and other people have got their nans, other kids have, and I just think she's lost out on that as well.
How are you feeling? I'm all right. I just want it to be the morning time. Yeah, it'd be nice. I'm not really enjoying tonight.
Hello, King's Resource. Yep.
fall from 3 floors, 10 minutes.
We're gonna have to take.
5, aren't
No, there's someone in 5.
6, sorry.
4.
I wager he'll need a bed one way or another. But what bed, I don't know. Has that gentleman over there got a bed in ASU? Do you know?
On shift to oversee the hospital tonight is Gordon, King's clinical site manager.
A lot of people, you know, they say, oh, who are you? We tell them, oh, I'm the clinical site manager, and say, what do you do? And I basically say, I do all the jobs nobody else wants to do. Oh, yes, you've got a bed.
Oh, that's all right then.
You might be coming in, it might be a nice day, nice be calm. There's actually beds in the trust to put patients in. That is the perfect scenario. But then you come in first thing in the morning, there's still 12 patients to be placed from ED, another 12 in AAU, and you know, you're starting from minus 24 beds, so you know you've got a hell of a day coming ahead of you. But you get on. Gives you a buzz. You know, I enjoy coming to work. Yes, I'm older now and I'm a little bit slower maybe, but I think because of my experience, I don't have to run around so much.
Oh, I know, don't start.
Sorry.
You've got a bloodshot eye, darling.
Have I?
Yeah, really bad. Check your blood pressure.
Look at my eye. Somebody says I've got bloodshot eye. I need to get my blood pressure checked.
You want me to check it?
Yeah, can you? Just to see.
I've known Gordon since I've been here, which is about over 11 years. You know, the first thing I'll always see when I say Gordon, I say, do we have any beds? And he would say to me, you are joking.
Gordon's having his blood pressure measured, as it may be the cause of his bloodshot eye.
You have high blood pressure?
No, we don't.
Wow, Gordon. No way.
That's a little bit worrying, isn't it?
Show me. That is high. You think of sustained high blood pressure, all the damage it can cause to various organs within your system. So it's quite worrying because he has other things. Not feeling well, headaches, you're wondering what's happening here. That's high, Gordon.
I don't know what I would do.
I'm 6 months pregnant, and I stupidly thought, oh, you know, I'll get a little bit of sleep.
On Saturday night?
You're fine. I get a little bit of sleep.
No, number 4, please. Don't like 6. Number 4. Spit it out for us. Spit it out.
All right, it's very good.
Good boy.
You know, there's no point being, oh, poor you, poor you.
Wake up for us.
He's had so much diazepam, he'd be sleeping till next Christmas.
At the end of the day, you need to either change your life or stop climbing up ladders with flip-flops on. You've got to be firm and fair.
The patient doesn't want to stand up, well, we're not going to cure that, and she needs to go home.
I'm just about to become a patient. I've got high blood pressure, 180 over 110. My right eye is bloodshot. He's got headache.
After a colleague noticed his eye was bloodshot, hospital site manager Gordon has been taken off his shift with dangerously high blood pressure.
Anybody else want their blood pressure taken? I'm doing a staff blood pressure check this morning. Anybody need, just come to my office. Get a full MOT.
So I'm just waiting to be seen by the reg, and they said that possibly they might want to scan me.
as medical professionals, I think we tend to carry on. And we carry on sometimes if we're invincible.
I'm sorry about this.
I care all day, and that's what I do. My job is caring, but we never stop to say, do we ourselves need that care? Number 4, Gordon, this is what it has to come to for me to see your chest. Into number 4, please.
Gordon's blood pressure is so high that he requires immediate medical attention.
Look after you, and then we'll let you look after the hospital afterwards.
Sharp scratch.
His symptoms could be a marker for a more serious underlying disease, and he'll need further tests to establish what the cause is.
I think we're reluctant as medical professionals to seek medical help. That's one thing I can always say about kings on a whole. We look after each other.
He had 15 milligrams of IV diazepam, 5 milligrams of PR. Is this the dislocated shoulder? I did ask for them to just wait.
Gynae came in wanting to cause chaos and hurt others. He's going home now.
I was in so much pain, I didn't know what to do, Stuart. I thought, oh, am I going to have a major
Heart attack.
heart attack?
88-year-old Irene has been brought in by ambulance suffering with severe chest pains.
I thought, oh, it must be bad, because you never pulled the alarm, even when you fell over last time.
No.
Thrown everything in the car and rushed up from Margate.
And I thought, oh, I don't want to phone any of you, you know, because you'll be worried.
All the time I was driving up there was thinking, will I still find her alive when I get there? 2 hours is quite a long time if you've actually had a heart attack or something. A horrible thought going through your mind, really.
With a headache? Headache, bum-ache, bellyache. Everything. Oh.
Hello there, is it
Hello.
Irene?
Yes.
Hi, how are you?
I'm all
Could be better.
Silly question when I'm in hospital.
What happened?
I've had a heart murmur for years, and this morning it hurt, and in the end I just had to push my button thing.
Okay. Where, do you live in a warden-controlled?
Yes.
Yeah, okay. And how bad is it out of 10?
Well, 10.
I love elderly patients. I just think the stories they can tell, and they've got so much balls, and, you know, they've got a bit more backbone.
And what medical problems do you have?
None really. I'm quite a healthy person. I've got a cyst in my stomach.
Okay.
2 hip replacements, a knee replacement, this shoulder, and I should have this shoulder and this knee done, but it's not the operation, because it's that wretched anaesthetic. It makes you so daft.
Yeah.
My son says, you're dafter than usual, Mother.
My mother's always the last one, really, to say that she's ill. She'll always say she's OK, even when she's not.
What, are you taking any regular medications?
It's in there, my Dorset box.
Is it this?
Yeah, that's what I take.
And when we think she's unwell, when we ask that, we call the doctor, really, because she won't call the doctor to come and visit, so we call the doctor. But even when he comes in and asks, you know, how are you, she's like, oh, I'm fine. So you never quite get to the bottom of it.
So I think we need to do some blood tests as well,
Yes.
just to have a look that there's nothing else going on.
Yeah.
And also do an X-ray of your chest.
Can I report to recess, please? That's reported to recess.
You know, I always say that we think we plan our lives, but we don't really. They're all planned out for us from the day we're born. Describe Les. Well, he was just a very nice, caring man. I hardly saw him. We got engaged and off he went to Canada to learn to be a flyer. I was 15 and he was 19. So I didn't see him practically for the whole of the war. It wasn't until he came back and was demobbed, and then we got married, and he was married in his uniform because he hadn't got another suit that fitted him. He'd grown while he was away.
Sorry, my name is Sylvester, I'm one of the porters. I want to be a bit comfortable.
Oh, you're right.
Right.
Yeah. Did you say Sylvester?
Yes,
oh.
Sylvester.
Like the cat.
And I get that every time.
I'll say you're fed up with hearing that.
I'm not bothered anymore.
I mean, you've got to remember what they've seen, what they've gone through. We have got no idea that we're born now, you know, and I do. I just think the older generation are absolutely incredible.
Have to pretend your name is something else. The war, the bombs, they're very different. Frightening times. I remember one night when I was lying in bed, and I woke up one night and I could see these boots marching past the window, and I was terrified. I thought, we've been invaded. But it was the Home Guard doing their practice. Yeah, always remember that.
He's got a stable pelvis, but he needs skin traction. He needs to be consented, but he needs to stay here until he's awake. Yeah. You know, and I need to assess.
Resource keys. There's some in the cupboard.
No, I haven't got them at the moment.
Who's got the keys?
Anna, keys.
That's it for that, really.
Can I please have a porter with a wheelchair to Major's Cubicle 8? Thank you.
Grace was brought into King's earlier in the evening with suspected spinal injuries, having fallen down a flight of stairs at home.
I feel really sick. You've got to remember, yeah, you came down and you've knocked yourself, yeah? So it was really scary in that X-ray thing. Have you ever been in one of them? No. It was really scary. You just panic too much, yeah?
Doctors are waiting for the results of Grace's scan to see if the fall has caused any serious damage to her neck and spine.
Have you got any funny feelings in your arms? Do they feel weak or pins and needles or anything like that at all? No? Okay, let me just have a look at them. Like this. Keep them up even when I press on it. Keep it up, keep it up, keep it up. Keep it strong. Stronger, 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 stronger. Don't let me, don't let me.
Ah, thanks.
Oh, this might be them now. Hello. Hi. Okay. Yeah, I thought so. Bye, bye. That's all. I think it all looks all right. Yeah. I think your x-rays look all right. So what I'm going to do is just take this off. When they first come in, they look one way, and then once they've been woken up and all of the blocks have come off, it's just amazing to see who that person really is. Ready, slow? Yeah.
The all clear means that Grace's neck brace can be removed.
Put your socks on first, Grace.
How does that feel now that's off?
Wow.
Not very nice, this, is it? It's a bit uncomfortable. Tomorrow when you wake up, I think you're going to feel worse than you do now. Okay, because all that bruising where you've taken, everywhere's taken a bit of a bang.
Okay.
All that bruising is going to come out.
Yeah, no worries.
Shall I sit you up just a little bit?
Okay.
Yeah?
But Dr. Flur will keep her under observation to ensure that she is safe to go home.
Do that if everything is okay. Then
yeah, that's fine.
go home.
All right, lovely. Thank you. Thanks.
I never really had that chance to experience or show my mum the woman I am really now, and also the mum that I am. I never got that chance. I think that she would be extremely proud. I think that she would be... I think she was always worried about me.
Take it slowly, because you haven't been standing up for a long while.
All right. Thank you.
Yeah, I think she'd be proud.
I know you're probably not thinking of yourself at all, but will you get him in a snuggle and I shall feed you a double-decker so you've got some energy, all right?
10-month-old Dexter is under observation, having been brought to A&E with a high temperature by his parents.
No, you can't have any double-decker. Chocolate bars are the realm of adult pleasure only, I'm afraid. Although if you come home in tip-top condition, I might consider finding you something chocolate-related. Well, you can't look at me with such covetous, envious eyes. You can just pick the bits off of Mummy's boobs. Mm-hmm. That beats the crap out of Diary Light, doesn't it? Let's get this straight. 2 minutes ago, you were lying in a pile, lifeless, as if the world was about to end. 2 minutes later, after a little bit of chocolate, you're absolutely fine. I bet your temperature's dropped as well, isn't it?
I remember spending 4 hours in A&E once when your mother had a fishbone in her mouth. She had a fishbone stuck in her throat. Long time ago.
4 hours?
I'm afraid it's very boring being in A&E. You see, what happens is that if someone comes in after you and they think it's more urgent, it's a more urgent problem, and sometimes that's like a baby or something like that, you know, then they'll get to see the doctor before you. It's just the way it goes.
Yeah.
Haribos.
Haribos?
Yeah.
Haribos?
Cans on the other.
Porters Major's aid to take patient to X-ray, please. Porters Major's aid to take patient to X-ray.
What, entertain yourself?
Can I have a high-speed river resource to top up?
You're off, boy. Yes. Look at him. Oh, wow. You're smiling as well.
He had a 40-degree fever, and he had a bit of double-decker, and then he livened up a bit, and then another bit, and then another bit, and then suddenly said, you need to get a stack of double-deckers in here, and then your waiting list would be down in no time at all.
Oh, wow.
Chocolate is the universal medicine.
I think that's just where my father lives strong inside me. It's that until the worst case scenario comes to fruition, don't waste your time worrying about it.
Love you.
Very high blood pressure, 180 over 110. I've got a headache and I've got a bloodshot eye.
I said you didn't have you got a headache.
So we're just waiting for the blood results.
Doctors have ordered tests to find the cause of Gordon's dangerously high blood pressure.
It's just you don't think about these things.
No.
You know, you just plod along and...
You have to be fair, you haven't really been well for a couple of days, you're breathing and stuff
Yeah.
as well.
I've just been tired.
He was admitted earlier into A&E whilst working his weekend shift.
Got to remember, you know, I'm not a spring chicken anymore. I'm not. I'm the oldest in the team now. So it takes its toll. Maybe tells you you can do this job up to a certain time, and it's like sell-by date. And I think maybe it's trying to tell me I'm coming to my sell-by date.
Welcome to World War III.
That's been the theme of our night. Punching and kicking nurses is the theme of the evening.
I'm not walking on your nice floor, OK? We kind of survived. Oh.
88-year-old Irene has been brought into King's by ambulance. She is suffering with severe chest pains.
One of the carers said to me, "Who's that photo of that little boy?" I said, "What, me holding him when he..." "No, the little boy when he's got his fingers in his mouth." Oh, I said, "That's my Adam."
That's Adam, yeah.
She said, I used to do that. She said, and I still do it.
Ah.
Oh, dear.
I don't think he does it anymore.
No. Not like you when you were a baby.
Yeah, thank you. Don't want to
Your
go
green rabbit that Auntie May made you.
Yeah.
You'd had one ear up your nose. You don't ever stop being a mum. You always worry if something has happened to them.
Yeah, not much to
Yes, yeah. Yeah, big babies. Because they are big men. I think they've all got a 46-inch chest.
Okay, your heart tracing is actually fairly normal. Like that,
No, that's...
Which is good. Okay?
Yeah.
So probably move you into one of our areas that's a bit more comfortable than being on here,
Oh,
okay?
right.
While we wait for those test results to come back.
Okay.
And if they're all normal, I think you can go home.
Oh, good.
Okay.
Makes you realise that, you know, your parents are getting older and they actually need a bit more care and attention now than they did. You always get used to them just being there and being sort of someone you can call on or ask to do something, and all of a sudden that's not possible anymore. And it happens to us all in the end. It's just, you know, you see it, you know, I suppose you get a view of mortality, don't you, really?
We have an X-ray, chest X-ray for Gordon. Could I send him around? Thank you.
I think a lot of times nurses and even doctors, they don't think about their own health. And that was true with me. I never thought about my health. I thought, no, I never get ill.
You have the pleasure of taking Gordon to X-ray, please.
Right. I had a chest X-ray. And it came back and there was something showing on my left lung, which they didn't know what it was, but it shouldn't have been there. So they referred me to the King's Chest Clinic. The first thing that comes into your mind is cancer. They made arrangements that I went for a special scan called a PET scan. Had the scan, then I went back to the clinic and I had lung cancer. But because somebody noticed it and said, let's just check your blood pressure, and by that one single blood pressure check, that's how everything was picked up. Possibly could have saved my life. Because now I'm getting the treatment for my lung cancer. Because if I didn't know that, goodness knows how long I could have gone on with this, not knowing. Never give life up until there's no other answer. So I will be fighting this all the way, and I know at the end of the day I'll come out triumphant. I've got 4 beautiful grandchildren. I want to see at least one of them get married. So that's at least another 10, 15 years down the line. So that's my first goal. And the rest, well, it'll be a bonus.
I paid for my funeral. I thought that's something less for my sons to get upset about. So I paid for all that and bought a little headstone. And on it I just put Les's date of birth and when he died, and just left room for mine underneath. So that was all sorted. What a subject to get on to.